start, and then Martha may have something to add to that. But I think right now, the stages of service, if you look at investigation, FBSS, and CBS, it's hard to say the numbers because it all is dependent upon the population, the area, the region. But those three basic stages of service are in place today. And the supervisor to worker ratios here in Texas are not that high. I mean, 7.5, we found about 7.5 to 1 supervisor to worker. Now, some states are lower, and the child welfare standards, I think, are a little lower. But other states, you're right where I think Florida is, you're where a number of other states. So you've got I think, supervisor ratio that works. What we tried to do, and it goes back to our organizational changes as well, we think your FBSS and your investigation ought to be working together closely or closer. We observed in the communities that those handoffs sometimes are difficult, Doctor. Some of the FBSS workers are not taking some of the investigation cases, and there's an argument at times. There's a difficult issue. When you have a supervisor that supervises both investigators and FBSS, it all seems seamless, and a lot of the difficulties of those passing cases go away. So we were in Beaumont, and in Beaumont area, and I believe in Lubbock, where they had supervisors that did investigation and FBSS, and we saw a lower turnover in that area. We heard a lot about supervisor morale was up in that unit we met with. Now, this was only a unit in 2 areas. Then we looked at a study that CPS had done, reviewed, that actually had a lower turnover with a dual supervisor role like that. The CVS is a little different. So having a separate supervisor in that unit, the CVS is okay, and then they have the program, administrator, program supervisor beyond the supervisor. What I would say is, when you look at the units, if you could do that, so we said in our organizational changes here in state office, they have a different division for FBSS, and they have a different division for investigation. And most states, those divisions are combined. Those activities are seamless. They're integrated. And we feel strongly that that would be a really good model for them, and we recommended that. So, and then the final thing is, I guess this is probably the most important thing, is that the unit needs flexibility within its budget. So you may have all of a sudden a turnover on the CVS side, and there may be a problem there, but investigators, you don't have a problem. And I want to take an investigative worker and fill in a CVS spot to help us over here in a unit for the time being. Today, that doesn't happen. And there may be budget constraints that we do not look at completely statutorily or budget regulations, but it just doesn't seem like it's the best system. So if they have flexibility, we feel strongly that that could help. So does that help you?
Thank you. Yeah. The one area that we did focus a lot on was we felt that unit that John talked about is basically okay. But if you look at the regional structure, we looked at the number of specialist positions that are at the region and whether there is appropriate coverage. You've got a big territory to cover. And so how much were the frontline workers able to really tap into those niche specialists where there were maybe only a handful of those people per region or across the state? And is that really giving you the impact that you need from those really super specialists? And what we were looking at is how do we get that knowledge down to that newer worker? If we are going to have a lot of new workers, because we're not going to take turnover to zero. It doesn't happen in this area of child welfare. So if you're always going to have some new workers, how do I commingle and how do I do that sort of Vulcan mind transfer of knowledge from my really great specialists who have a lot of deep expertise to my newer worker? What's the best way to knowledge share?
Any other questions of the Stevens Group? Thank you.
Thank you very much.
Great work, and I think it's so interesting that it was so well meshed with our sunset report. All right, we'll hear from the agency now. sir. Welcome back.
Thank you, Madam Chair. Again, for the record, I'm Kyle Janek, the Executive Commissioner of Health and Human Services. The time is late, and I'm going to keep the oratory to a minimum, but let me just say this. There are lots of times around this building when people can question whether something that you do or whatever is a necessary function of government. Nobody disagrees. This is a necessary function of government. I am happy to answer questions, and we will both talk about APS, child care licensing. We will not take our eye off those important missions as well, but we understand a lot of the discussions generated around CPS. I instigated this outside view because I referred to it at the time as a business process review. I wanted to see what the day was like for the caseworkers, not just investigative caseworkers, but family-based safety services and conservatorship caseworkers as well. I had no idea the wealth of data that we would get from this, but it was money well spent. There are things in there that we could prioritize and get done quickly. There are things in there that we will need your help on. Quick example, federal law may require some minimum activity on the part of the caseworker. State law through the years may have been built up to where it's kind of the same but not exactly the same, and maybe it's a little bit more stringent. Trying to rectify those can cost the caseworker important time. Little bitty things add up to the caseworkers. Little things. How quickly do they get because they drive around, they drive their own cars around, generating mileage, right? They go all over the place, all over the area, doing their jobs, and then they get reimbursed. How quickly do they get reimbursed? For a job that doesn't pay well, seems to me you try to get them their money fairly quickly. We don't always do that. Those kinds of little things will add up to create the culture. It's not one thing. It is not one thing. But if more than anything else, there's something that goes to the culture of an organization, it is that everybody who has a job feels that their job is valued. I'm not getting around to morale and all the rest. I'm just saying they need to know that their job is important and that they are empowered to make decisions. Not run outside every 15 minutes and call a supervisor. Can I do this? May I do that? All the rest of that sort of thing. They need to be empowered. We need to find the right people to do these jobs and then let them do their jobs. Obviously, they make mistakes. We'll have appeals processes if the family feels they were mistreated, that sort of thing. You can build those into it. But at the end of the day, we need those caseworkers to understand they're the frontline. They do the job, and what they do is important, and we're going to make sure that they give them the tools to do their job. And strip away all the little things that add up, layers that have built up over time, document this, chart that, all those sorts of things. Get some of that away and let them get back to doing the job at hand. So with that, I'll turn it over to Judge Specia.
We well may have created the perfect storm. When we hired Stephen's group, we didn't know what Sunset was going to do because Sunset does what they want to do. We told the Stevens group what we needed them to look at, and the way I did find it is I wanted a deep dive. I wanted them to get down to the base level. It's really easy to say what's wrong with CPS. It's a lot harder to say how to fix what's wrong with CPS. So I want to thank Ken and Amy. They did a great job, and they weren't supposed to tell us what was right with the agency. They were supposed to tell us what was wrong. And we agree with their recommendations. I'm going to just not get into it. We agree that we have these issues, that we need to address these issues. Interestingly, I've been addressing them since the very beginning. I spoke to Dr. Barry Bales yesterday. We hired him with the money he gave us last time. He wouldn't come to work for us unless we would do cultural change. And that was a year ago. He said, if I'm going to do leadership training, I won't come there unless we're going to do cultural change. I committed that to him a year ago. We're doing that training right now for our PDs and above. We're working on supervisor training. There are a lot of good supervisors out there. Now, the fact of the matter is we've got to have a lot more good supervisors. And we have to have those supervisors mentor the other supervisors. So it's really hard sitting there and listening. I wanted to come up and talk about an hour now. But I am going to just briefly, because some of the members don't deal with this every day, so let me just briefly run through what we do at DPS. We fulfill our mission through a lot of different programs. The Sunset Report focused on the leadership issues, and that is an issue I've had since I started. We conduct investigations and provide right services when necessary. When a child's safety cannot be guaranteed, we can petition the court and take children into care. On any given day, we have 28,000 children in care. Today, 10,000 of them, Representative Dutton, are in kinship care. We lead the nation in kinship care. We are going forward much faster than anyone else. This is a very challenging job, and the turnover is an issue across the country. I meet with my colleagues across the country, and this is an issue you talk about all the time. The Stevens Group is really giving us a template, and I'm glad they gave it all to us, but yesterday we started meeting on the alignment, on setting the priorities. One of the things that Sunset says we have to have a business plan. So what we've got to do is build a business plan on the Sunset Reports and on the Stevens Reports of where we're going to go first. CPS is 90% of the agency. Sometimes my other programs feel that way, so I can't ignore them. One of our very, very important programs is prevention and early intervention. We do that primarily by contracts. The recommendations about moving them outside of program and elevating that, we completely agree with. We are going to move prevention right below the commissioner, and we are going to focus on prevention. If they give us other programs, we will take other programs. That's a decision that's going to be made somewhere else. Our child care licensing division is very, very important because we license all the daycare centers in Texas. There are over 1 million children in daycare in Texas today. They also license and regulate all the child care agencies and all the foster homes, and so that's a very important division. They gave us some recommendations on how we can strengthen our regulations, get immediate cease and desist orders. We completely support those recommendations. APS is a great program, and somebody was talking about moving it. Senator, it's a great program. It's running real well. It didn't get any recommendations. I kind of like to keep it, but it's that next decision, not mine. There are some playovers. Sometimes when we go into an investigation for an elderly person, there are children being abused and neglected in that home also. So there's some collaboration between APS and CPS. Where there are abused, neglected, and vulnerable people, sometimes there's elderly, disabled, and children at the same place. So there is a certain amount of logic having them together. We're focused on safety. That has been my number one focus since I got there. The interesting thing about this agency is every day, thousands of our workers work with children and elderly adults all over the state of Texas. We're open 365 days a year. When I'm having Thanksgiving dinner, I always say a prayer because there are workers out there working and protecting the most vulnerable adults in Texas. I really want to just get into the questions, but I forced myself to do this. I would like to talk about the various issues that were raised by the members, but I'll let you all ask the questions and I'll respond to them. So I'm available for questions.
Commissioner, how do you, we've had between Sunset and the Stevens Group, we've got nearly 200 recommendations. And I applaud the decision of bringing on the Stevens Group. I think it was such a nice compliment to the work that Sunset was doing. And it's so clear to me where we need to focus our attention. But how do you strategically implement all of these recommendations that are coming your way?
You don't. You look, first of all, you don't. The bottom line is John Stevens says you don't. We're going to look at the recommendations. We are going to prioritize them. We're going to pick the most important ones to start with. The mentoring program. I want to start with that mentoring program. That's an important program. Now, I may want to experiment a little bit because I think there's benefits to both the Sunset recommendation and the Stevens Group recommendation. I want to try using workers in the field, reducing their caseload, maybe giving them a bump of about $300 a month or something, and making them mentors and going to like what the police department does, a training officer. When you go into the field, you don't go by yourself initially, and extend that training over a year. I think that would help with retention. That was part of this program. I didn't know anything about it back in 2011. It was reduced because of budgetary issues. That's really important. We're going to get there. Now, I have a concern about if we put extra work on the mentors, they're actual workers, we don't reduce their caseloads. So maybe I ought to try both. Maybe I ought to try a mentor worker and maybe a dedicated worker and see which one works best. I got a big state. I can easily try both. We can make the changes in state office before Labor Day. We can restructure and focus that support on the regions and the regional work. We can get information on turnover to the regional directors, to the program directors, to look at which supervisors are keeping people, which aren't keeping people, which regions are having problems. One of the recommendations, we should hold regional directors accountable. Now, I will tell you, there are places I need to pay my workers more money. Midland, Odessa. I've already done it. And I haven't paid them enough. The cost of living went up 300%. I gave them a $500 bump. You gave them the authority to do that last time. That's not enough. I found out the Railroad Commission does $1,200. We're going to have to raise that. So our pool of workers is impacted by the economy in certain areas. And so we're going to need to look at that. And I like flexibility, not paying everybody the same thing across the board, but looking at the economy, looking at where we're having trouble with our workforce, where we're having trouble with recruitment. Recruitment is critical. If we're losing a lot of people in the first 6 months, we're not hiring the right people. They need to know how difficult this job is. I heard something the other day. A worker quit after 6 months, right after they got a training, they didn't like working with families. Well, why did they take this job? Why did I hire that person? It drives me crazy that I hire 3 people. One of them becomes a great worker and stays for a career. The other one's a really pretty good worker, stays 2 or 3 years. That's fine with me too. I can live with that. And then I lose that next one in 6 to 8 months. We're not doing a good job at the front end of making them understand how hard this job is. This is a calling. This is not just another job. And if you apply for this job just because you're looking for a job because you just got your degree, and we don't explain to you how hard it is, then that's our fault. So I now have hired a retention specialist. 364 people, Senator Ureste, filled out that exit survey. That's not a lot. I've hired a retention specialist. The people that quit last month, he's calling every one of them to find out why they quit. So we're changing up our whole division. We're consolidating all the workforce functions together, and that is going to be our number one focus. Because if the working conditions are bad, we've got to make that better. Because no matter what you pay someone, if the conditions are terrible and you can't feel the kids are safe, you're going to leave. So it's a chicken and an egg. We have to work on turnover. They have to be paid enough money to pay their bills, and we have to do that. I'm rambling now.
Madam Chair, if I may, I've wondered at times whether a caseworker starts to get stressed, distressed, a little bit overwhelmed, and whether we should give some sort of a respite. In other words, move them out of investigative caseworkers, close what you've got, don't quit on us, close what you've got. Let's see if you want to move over for some period of time into, if they're cross-trained, into family-based safety services or conservatorship, and pick up some of those cases, because then they're not seeing exactly that same situation with the question of, is this child abused? And, oh my God, this is such a huge decision. Take the child, leave the child. I don't know if that works, but my gosh, we ought to try. We ought to ask the caseworkers if some of them want to do it. So we haven't thrown that experience and that training out the door. We then say, okay, let's get you off the, Colonel, if I may, I didn't serve, but if I would say get you off the front line and get you back for a little R&R. It's not that that job is easy, conservatorship or family-based safety services, but it's at least a break from what you were confronted with. And so there's a bunch of difficult things we can try. I will disagree. We can do all those. We can implement all those things. I think your question was, how do you decide what to do first? So what we should be doing first are the things that we already have the latitude to do. And as I mentioned in that last session, if there's things that we need, changes in statute, we'll come to you with those things. I can't worry about those until December, right? We got to start working on the things we can work on right now. And that starts with letting the caseworkers understand. We heard. I know you've been surveyed multiple times. We heard, and let's start peeling away some of those things that bog their day down each one is important. At the end of the day, it's not as important as spending time with the family and getting to really understand what's going on with them, spending time with your mentor and your supervisor to say, hey, gang, everybody huddle up. What are we going to do with this situation? We do stupid stuff. We hand off kids. The judge in an area will say, not this judge, a judge, will say, okay, I'm going to adjudicate you taking the kid, and the kid's going to go live with relatives 6 counties away. Great. Here's the thing. What does that handoff look like? We had a child death that you read about on this. We didn't have a smooth handoff for the caseworker who's picking that case up to understand all the nuances of this multifaceted, split-up family with members moving in, moving out, some on drugs, some not, all this sort of thing. And it was not a good handoff for that caseworker that's receiving this case to understand what was going on. The judge has a vision and a way to fix certain things like that. Stop doing the stupid stuff. Start doing the stuff that makes sense. I'll say one more, and this is big dollars, so don't even hold me to it. But here's the thing. What I'm about to tell you is not new money to the legislature. We do this, I think it's across the enterprise, but hear me out. Child Protective Services. Caseworker will have to earn up to 240 hours of overtime before getting paid for that. You think about that. Oh, yeah, we need you to spend another 4 or 5 hours today, this week. You're not going to get paid for it until you accumulate 240 hours. Now, y'all are going to eventually pay for that. You are. When they leave, you're required. And the only reason it's not more is probably because federal law won't let us do more than 240 hours. Can you imagine having to accumulate 240 hours on a job that doesn't pay fantastic to begin with before you start getting paid overtime? So you're going to pay that caseworker eventually. Could we at least drop it? I don't know, 200 hours, 100 hours, something. Just something. Money you're eventually going to spend, but up front, let's see if we can get the money in their hands. I can't imagine something where the supervisor comes and says, hey, by the way, you're going to pick up another 6 hours because so-and-so just left the agency. And I'm thinking, gosh, at this rate, I'll get paid for this overtime sometime in the middle of next year. It doesn't make sense. We got to stop doing stupid stuff. Start doing the things that really do make sense. I believe so many of the things that we need are in there, and our dedication to you is to do these things without coming back wanting more money. But if we do, there's going to be a justification for us.
Let me, just while this is on my mind, since you talk about stupid decisions, I'm so concerned about CPS closing cases when they shouldn't be closed. And I don't understand how that's happening. Or there was one case that was we had jurisdiction over a case where the caregiver was the perpetrator. They said that CPS discovered that a soccer coach was the one abusing a child, and they closed the case because the soccer coach isn't the caregiver. I mean, that child's still being abused. I don't understand how that can happen. There was another one that caseworkers closed the case when the identity of the perpetrator was unclear, or family members of the child couldn't be located, although evidence suggested that abuse had taken place. I don't know, Commissioner, what can we do to keep those cases from being closed when they aren't supposed to?
Well, I can talk about quality.
And those are just examples.
Well, and that's quality decision making, and that is training. A tenured worker shouldn't do that. So we've got special investigators now, and because you've lost somebody, you shouldn't close the case. You got a special investigator to go find that person. Right. And there may be a case where we simply can't find them. There's a protocol we should go through to make sure we've done everything we possibly can do to find them.
Well, and that's the key. Are we doing everything possible before we close that case, or is it just important to
our policy? No, I think our policy states clearly that you're supposed to do everything you can to find those people and not just close the case because you couldn't find it. That should be a very small percentage. Now, sometimes somebody goes back to Mexico, you're never going to find it. Right. So you can't keep that case open. Right. So, I would need to look at the specific case you're talking about.
And well, let me ask one other question, and then there are other people that have questions. This was on my mind. There are are there cases that are required to be referred to law enforcement?
We refer, I want to get this right, all cases to law enforcement. We send faxes. Now, there's a difference between how you refer cases and how you don't refer cases. We're talking to the child advocacy centers about working closer with them where there's a criminal aspect, and they would get copies, and it's part of our modernization program. So they would take up, we don't prosecute criminal cases.
Right.
And so the referral, it's up to law enforcement what they do about it. And I've heard horrible situations where it stayed on the fax machine.
Me too.
So, I mean, there's a problem there. Our relationship should be good enough with law enforcement that the serious cases are referred and they're tagged.
There we go. And I want to know how to improve coordination with law enforcement, because what you're describing has happened. I mean,
I think
send it over to law enforcement. We drop it because we assume it's being taken care of. It's sitting on their fax machine, and there's a child out there that's being.
Our relationship with the child advocacy centers is improving dramatically. We're in discussion with them all the time. We're going to have a line item in the appropriations to more involve them in this kind of thing. They focus on the criminal piece, and so that's a collaboration that we need to build to make that better. But every county is different. You got at least 2 law enforcement agencies in every county, or one if it's in a small county out in West Texas. We've got to have good relationships with those people to make sure the referrals are picked up on.
Thank you.
It's important to note, Madam Chair, that, and you know the child advocacy centers in your areas. I've worked a little bit with one in Houston. I mean, they're generally known to the lawmakers. Here's what I didn't realize. Turnover is lower where we co-locate with child advocacy centers. When you think about that, it's because we co-locate with them, and your turnover is dramatically lower. In the back of my mind, I was going, yeah, what'd you think? Why would you think it would be any differently? You've got your caseworkers in with law enforcement and other folks who are saying, hey, by the way, we've seen this kind of case, or we've heard about this. It's that unit of everybody being together. And so to document that turnover is lower in where we co-locate, why are we not doing more?
Yeah. I'm sorry. Senator Swerter, you've been waiting patiently on them. Senator Dean Adamson.
Thank you, Madam Chair. Commissioners, Judge Specia, I just want to say my staff is quite impressed with you, and I look forward to speaking with you in the morning one-on-one. I appreciate your willingness to try to cut the Gordian knot here and improve DFPS. In reference to where the rubber meets the road, it's CPS investigations, caseworker turnover, in my opinion. And there's a whole lot of different ideas, and Senator Nelson hit on that in her first question to you. There are so many recommendations about how to improve that from both studies as well as the Sunset Commission. But would it be fair as a legislative governing body to judge the performance of you and your agency in 2 years by a reduction of that caseworker turnover of investigations from the current 32.3% down to, let's say, 25? Because it would seem like if you fix that problem just incrementally, the rest of DFPS has to be functioning better.
Actually, the goal I've set is 24. 20 sounds better. That's my target, is we need to bring
in 2 years.
In 2 years. I'd like to do it in 1 year. John Stevens thinks I can do it in 1 year. We're going to focus on that. That is my goal, is to bring that down. The impact modernization is a problem, because right now what we've done in the first year is fix the guts, and making it more user-friendly for our young workers is going to take at least another year. So some of the changes in policy and different stuff, we keep running into the computer. Now, y'all gave us a lot of money to work on it last time. It just takes time to get that done. The practice model, since I've got 8,500 employees and 5,000 workers, it's got to be computerized. I can't send it out there with paper. Being able to upload things. This business about they spend a lot of their time typing, but then they spend a lot of their time playing with paper. it's not set up right now where you upload pictures and upload interviews. And so we're in the process of making all those changes, but the frustration with the computer system is going to be here for another year or so until we get the changes made that make it much more user-friendly. So we're going to attack, let's get the right people, let's bring in the right people, let's give them training, let's make the training realistic, let's work on supervisors. We've got to have good supervisors. I talk to people all over the state, and when I talk to people that used to work for us, what I hear is I stayed a long time because of my supervisor, or I left because of my supervisor. So the supervisors are critical. I talk about the Marines. There's not a lot of old Marines, but there's a lot of good sergeants, and I need good sergeants. And that's something I've been talking about. That's reinforced by both Stevens and Sunset. So we're going to be working on good sergeants. We've got some training we started to use, but it needs to be a cultural change. And one of the things the Stevens report talks about is if we measure widgets, if we say you have to get X number of cases done a month, no matter what, no matter if they got dumped on you at the end of the month, whatever, then we're measuring the wrong thing. We're not measuring quality. We've been measuring the wrong thing. What we evaluate, our evaluation tool is all about numbers, about how many cases are closed, how many cases are closed within 60 days. We're going to change that evaluation tool. We're going to put part of the evaluation of the supervisors going to be have you retained your workers and get them focused on keeping workers. It's multifaceted. We're going to have to hit this thing, but we've consolidated all these functions and operations so they're not in different places in the organization, and we're going to focus on retention. I think that's got to be our number one focus right now. When we get the system fixed, when we've got workers, then we can talk about salary. Then we can talk about what we need to do if I still have a problem. But the working conditions are something we can do a better job of. Now, we're never going to make it a safe job. It's a dangerous job. They're going to go into horrible homes that they've never seen before in their life. They're going to get bitten by dogs. It's a tough job. So we are not going to have the state average on retention on the frontline CPS workers, but we can do better than 35 to 40%. I want to get us down in that 25%, 24% range.
Well, you have a lot of ideas that were presented to you through the two different studies of which tools to try to utilize. And I was actually heartened when you said that, well, we're not going to implement them all. Organization is very important as the leader of the organization, and which ones are most effective. You're obviously in the best position. We can all get up here and armchair quarterback you as which ones are going to be the most effective and give you advice, but you are ultimately in the position to implement the ones that you feel are most appropriate for your agency, with the end result being an improvement of the efficiency and effectiveness of the agency.
Absolutely. One of the things we need to do is try things, and if they don't work, stop them. This agency is not good at evaluating 6 months out. So I got 160 recommendations. I'm going to prioritize them. But if one doesn't work, I'm tossing it and going to the next one. We've got to evaluate our changes, make sure they're getting us where they want to go, look at unintended consequences, and keep that evaluation. We start things and they go forever. And so we're going to stop doing that. That's part of the pause. We're going to stop doing some stuff that is not of the highest priority and focus on the priorities.
Thank you, sir.
Thank you, Senator Hinojosa. And then Mr. Reese.
Judge, and I guess Commissioner Janek, we all know that being a CPS worker is a stressful job. But you ask a question, and one question, and you give us 20 answers from A to Z. And it's part of the problem. While very well to give the workers some stress relief. I think you feel when you're given the answer, but you go on and on and on, and cover too much territory that you lose your point. And the point is you need to get to the basics. Right? And the training, the leadership, the managers, and the type of applicant that you hire. In the computer problem, I've been hearing the same story about the computer problem for the last 15 years. It's never ending. So I really don't want to end up with 200 different types of approaches. I really would like to see it honed down and focus on some of the very basic experience that we have with training and management to be proven successful in other state agencies or in the private sector, and I come up with stuff, and give us a shotgun answer to a very specific question of what is to be done. Just kind of what I see, what I hear, and what I know from my experience. You cover too much, you can't do anything.
Well, and let me respond to that. I'll say sure. Respond briefly. I've seen it from the other direction. And once upon a time, we thought that giving the caseworkers the laptop, that was going to fix so many things. I don't want to oversimplify, Senator, because I think that's part of what got us into the trouble. Now, do I need to take up a bunch of time going through that litany of things? Maybe not. I just get excited when I start to think, for heaven's sake, there's something we can now work on.
Well, you don't.
Little things do need to be worked on.
I understand that, but we keep hearing the same thing in just such broad responses to very specific answers. And to be sometimes you try to do too much or reach too much, you lose your effectiveness. And I agree that it's not a matter of caseload, the number of cases you close, but it's not a very simple answer to issues that are faced with CPS. But certainly, it's got to be more focused. Because what I hear is everything from A to Z in terms of crime, you can't do that. And that's what I heard from you, that's what I heard from the judge. And my point is, we cannot lose sight of the basic in management, in leadership, in training, in terms of the quality of the applicants, the requirements that we have. We all work under a lot of stress. And there's no doubt that a CPS caseworker works under probably more stress than a normal person. But get focused on those basic issues.
I think we do. But bear with me for just a second. I will still argue that we don't have the luxury of time, Senator. I can't pick 4 things and then let's see how it goes over the next year.
We've been going on for the last 20 years.
We understand.
We keep doing the same thing. And I'm not blaming you.
Maybe so. I have a list of problems in front of me that each could be fixed independently. It's not that we're going to try to do too many things at once, because they can be done independently. A quick example. Lisa Black is our assistant commissioner. She's the CPS director. And I heard that they had great numbers, better numbers in the Dallas area than most of the regions of the state. And she was a regional director. Okay. I asked Ms. Black to drive down to Austin, and she sat in the conference room, and I said, so your numbers are better than everywhere else in the state, and they have been for a while. What's special about you? And she said, nothing. Okay, great. Yeah, I get it. What is special about you? Why are your numbers better in the Metroplex than they have been in Houston or San Antonio or the other urban areas? Why are your numbers better? It's in the manual. It took forever to start to get her to say, oh, I see what you're saying. We close a lot of cases administratively. You asked about closing cases prematurely. There are some cases that need to be closed quickly, administrative closures. And yet, we've got this culture of fear in CPS where that may not happen. They're professionals. You train them. You let them do their job. And if an administrative closure says, we understand what this is about, a couple of phone calls, you find out the real story, and we don't believe this one needs a caseworker to go to that house. Holy moly. I mean, that makes you, wait a minute, really? That makes me nervous. They're professionals with the right training, with the right procedures in place. You can save time. I'm not saying that is the sole answer. I'm saying you can do that in addition. You can do that. You cannot close cases early because you closed some other cases early.
Well, it's part of the training. It's part of the action.
These are all things that we can do independently of each other. It's not overreaching. It's not trying to do too much at once. They're little things that add up quickly, and I believe we're going to do the things that we can do at once.
I just don't want to lose sight of the basics.
Yes, sir.
They're pretty basic.
Let's get a caseworker trained, get them in trial that day.
Thank you. By the way, when he and I were, I guess, first-year senators, the first debate that he had on the Senate floor against each other, dealing with, I think, the medical board.
It was. He did.
answer. Mr. Luce.
You did a form of it with what you just talked about. One of the basics that I've seen in every organization dealing with turnover is who you recognize and how you recognize people. It's an enormous part of job retention is recognition. And we just hadn't heard much discussion of recognition. We talked about pay and supervision, but who you recognize and how you recognize them is awfully important.
Huge decisions those caseworkers make, and we've got to be able to back them up. We've got to give them the latitude to make the decision, but it doesn't mean they're just off on their own. We had a case not that long ago in Houston where a child was brought in and had a fractured femur, 1-year-old, fractured femur. And an orthopedic surgery resident had written, consistent with high-impact fracture. Boom. Those words triggered an investigation. The family's protestations, we've done nothing wrong. And the ER doc says, well, they sure seem a little defensive, and writes that in the chart. The father says, when told CPS is going to be called in, says, do I need an attorney? Oh, well, that's interesting. Why do you think you need these things built up into a case? So here's this family who knew they did nothing wrong, worried not only about, are we going to keep our kid, but we didn't do anything wrong, so why is this child's bone fractured? Osteogenesis imperfecta, brittle bone disease. They had the hammer of the state hanging over their head, right? And they did nothing wrong. Oh, and by the way, the kid's got a disease that's going to haunt that child for a long time on top of that. I'm not saying every case is that way. I'm saying you've got to build those things into the training. And don't say because somebody was defensive and said, do I need an attorney? Good heavens, that'd be my first or second question.
Madam Chair.
Senator Birdwell. Oh, wait, tell me, Mr. Luce, you finished? You're good.
Yeah.
No, we're good.
Well, it's not a question. I just want to add to the commentary. I don't have a question, but because of what Commissioner Janek has addressed here. With the sensitivity of what's happened between the family that lives in Connecticut that a doctor referred their daughter to a Massachusetts hospital, and a doctor with no affiliation with the case, meant that young lady spent 18 months outside of the custody of her parents that was just returned. If you think eminent domain is sensitive, try taking family members from parents. So recognizing that difficulty and that stress, we clearly want those employees to err on the side of safety. But the other side of that very single thin bridge is making sure that there's not an abuse of government. And that's part of the reason what y'all do is so sensitive. Because once it seems like, it's like we're all lemmings going over the cliff, assuming that something as simple as that can be taken as evidence to remove a child from a family. This is something that you absolutely must be right every time. And that's what, we're sensitive to, and it's clearly what the constituents of our respective districts are sensitive to, that your actions always have to be in the 10 ring.
They're training, let them do their job, have redress or appeals for the family, and make sure everybody gets around the table, the experienced hand and the newbie, and then make these decisions together. Doesn't have to be terribly time-consuming. It can be done.
Commissioner Woods, excuse me. I wanted to talk about recognition because we're doing a lot on recognition. One thing I'm doing when I talk to judges is to say it's your job to hold our people accountable, but you need to tell me when nobody's doing something right. So I get an email a week from a judge saying so-and-so did something right, and I send them a letter. We've got publications that we publish when our workers do things right. In Harris County, they have a Worker of the Month. So I agree with you. We need to recognize the good work and celebrate the good work, and we're working really hard to do that.
Well, and God bless them. Pass that on them. Caseworkers and educators has to be, other than parenting, some of the toughest jobs there are out there these days. These are our kids. So tell them from us, thank you. Representative Brady.
Just a couple of things. I want to touch on the Children's Advocacy Center because we have a great one in Laredo. Our community is just one of the best. And what we've done there is, of course, this has to do when a child has actually been abused by now, right? That child goes there and they're going to deal with CPS. They're going to deal with the DA's office. They're going to deal with PD. They're going to deal with county if necessary. They're going to deal with forensics. So that child doesn't have to go to 4 or 5 different places, right? That's the model we use in Laredo, and it works very, very well. Now, that's when a child has actually been assaulted, abused, whatever. What I want to mention, though, is when I deal a lot with your office in Laredo. I have a lot of parents that will come to me, or relatives that will come to my office. My office is in City Hall, so it's very easy to find them. I did it like that for a reason. And so through the years by now, we deal with y'all a lot. One of the things, and it sounds to me like maybe Senator Hinojosa deals with this too, where he gets approached by his constituents. I don't know about the rest of you. But one of the things that bugs me that I don't know, I wish Harold was here, whether we need to put something in the family code numbers, but when information comes to my office, when I get a 9-year-old kid come to my office, all right, and their CPS is trying to determine where that child's going to end up, getting back to Senator Birdwell, and I find out that apparently something that child is saying about what they think is not getting to the court. What I have done 3 or 4 times by now is I tell my district director, take it, let's write a letter and go present it to the court when they have a hearing. Now, as you know, Judge, that's not really an order. And the judges get mad at me. And I say, I don't care. I have this information. I'm not going to keep it to myself. If I've shared it with CPS and they've made a determination that they're not going to include it, or for whatever reason, and again, I'm not saying that they do it wrong all the time, because they do it right a lot of times. But nobody's perfect. And so I don't know if we need to put something in the code that says if someone in the legislature gets information that they deem to be appropriate or necessary or whatever, that it's okay to get it in front of the judge, and the judge can make the determination whether or not, in fact, that 9-year-old needs to be interviewed, if they haven't been interviewed, or they haven't been asked, well, what do you think would be best for you, going with your grandparents, staying with your mother, whatever. And it's a sensitive deal, but man, I've seen it. I've seen it in Laredo. And it's just, I know it gets complicated. But I really think, members, I don't know if it's happened to you all at all, but it's happened to me. And I sure don't like when a judge gets mad because I'm not part of the CPS and I'm not part of the attorney ad litem, guardian ad litem over here that's representing that child, who, by the way, isn't getting paid very much and doesn't spend a whole lot of time on the case. Right, Judge?
Correct.
And so sometimes those things fall through the cracks. Anyway, I hope we can work something in along those lines to where, even if it says of a legislator, I don't know, something to give us the ability to put it in front of the system.
Well, I've spent the last 15 years trying to train judges to bring children to court, to let them have their say and have their voice. That's a better answer, is for the child to have an opportunity through a CASA worker or a CASA worker brings that kind of information to court all the time. So where they have a CASA, and if our workers aren't taking something to the court, then the CASA worker can do that. Or the child, the ad litem want to bring the child to court and let the child have a voice in the court. So
but I'm telling you,
I understand the problem, man. I understand that.
And they'll argue when they're younger, if they're 4 or 5, whatever. Well, what's the cutoff? I mean, a judge, what would you listen to when you were a judge? As young as what?
As young as 4.
That's right. So.
Okay. Any other comments, questions? Thank you all. And we're going to move on to the Sunset Commission staff report for the Department of State Health Services. Call Sunset up here to present their findings. You might be stretched. This is the 7th inning right here. Right here. so we'll just all right. You ready? Okay, we can ask everybody to do your conversations out there when we're rolling. Ms. Robin.
Good afternoon. I'm Jennifer Jones.
Great to